So, hello, Dr. Kareem. Good morning. Assalamu alaikum. Good afternoon. So, doctor, we have some questions posed by dental students because they don't know what real dentistry is all about. So I'll just ask you a few questions so that you could clarify to them. Inshallah. So, doctor, for how long have you been a dentist so far?
I graduated from the University of Florida in 1982, so this would be my 30th year as a dentist.
Oh my God.
30 years.
That's too much. Okay, doctor, so why do you love this job?
To me, dentistry is the ideal profession for me. From the time I was in high school, I always wanted to have an occupation that was in the medical field. And after I finished college, university, my first university, I went ahead to dental school, and it was something that I wanted to do. This is something that I wanted to do. And as a matter of fact, I had a very close friend of mine whose father was a dentist. And this was one of the things that sort of gave me the aspirations to want to be a dentist.
So he encouraged you to become one?
It was very encouraging. It was very encouraging.
Right. So what do you think is the most important quality a person must attain to be a dentist?
Well, you have to have a certain level of intelligence. This is normal. And you have to enjoy helping people. This is one thing that's very important, is that you want to be able to help people. And you also want to be able to feel as though that you are benefiting society. You know, dentistry is a profession where you can, it's very lucrative, you can make a lot of money, but you don't want to go into a profession just because of making money. This will not give you satisfaction. This will only be sort of a temporary or transient type of satisfaction. But the reason why I really wanted to be a dentist was because I really wanted to help people. This was one of the basic things. It was not for the money. This is just some of the added benefits that comes with the occupation or the profession. So this is one of the things that you really want to help people. And another thing I think that's important is you have to have the ability to see the outcome of things. Because dentistry also involves a certain amount of art.
Art.
It's art. It's a profession of art and science. So if you have to have a view of what you want to see as an outcome, the end product. You sometimes can view this before it takes place. And once you follow the principles that you will be taught in school, God's willing, inshallah, things will turn out good.
Good, doctor. So, doctor, how do you think a person should treat patients? Like a doctor, right?
You treat patients as you would treat yourself. When a patient sits in the chair, you should think of yourself sitting in that chair. How would you treat yourself? This is how you should treat patients. You treat them as though you were sitting in that chair. This has always been my principles. This was something I even learned from before I even went to dental school. This is something I was brought up with. You treat people the way you want to be treated. So this is a principle I maintained throughout my 30 years of practicing dentistry. I always try to treat patients the way I would treat myself.
Okay, and what's a doctor's representative? I mean, his demeanor, is his demeanor important? Or confidence, or what?
This is it's important. Confidence comes with practice. This will come as you learn and you develop your skills and you start to work. The more you work, the more you do a certain form of treatment. Not just do the treatment on a routine basis, but the more you do the treatment, it becomes more natural. You develop your confidence, like anything. The more you sort of repeat it, the more confidence you build in yourself. So that's why it's important that once you've graduated from dental school, always tell the patients this thing: you have to get your hands, as I say, you have to get your hands greasy. You have to work. This is important. You have to work. You can view as many times as you want, but you have to work.
So there could not be a good doctor in his field?
Not necessarily. Dentistry is a profession that involves both business and medicine. The business and medicine. Some people are good at doing business, but maybe not good at doing medicine. And then vice versa. A person may be good at medicine, and they may not be good in business. You find a lot of doctors are not really good businessmen.
Yeah.
That's why you find in some offices, particularly in America, you have what is called a business administrator. So the doctor basically treats the patient with all of the things, the aspect of how much it will cost and all of these other things. These are normally discussed with the business administrator in the office. So basically the doctor he treats the patients. And the business administrator is the one who tells you, well, if you're going to do this procedure, it's going to cost you this, or if you're going to do that procedure, it's going to cost you that. Because doctors tend to become very, the word I want to use is empathetic. They have a lot of empathy, and when this takes place, sometimes they forget the business side of the profession. And as a result, they may do treatment on a patient. The patient can't afford it, but then you have to live. You can't just work free. No, you can do some things maybe at a reduced cost or sometimes free, but you have to work. So a lot of times the best thing to do is, if you have an office, have a business administration. This person will discuss the fees with the patient and so forth, payment plans and however it's structured. And you as the doctor, we can concentrate more on treatment. Because you don't want to be a doctor who's concerned about, well, is this patient going to pay me or this patient is not going to pay me? No.
Yeah.
This is a distraction. You should focus on treating the patient to the best of your ability and providing the patient with the best treatment that they can afford. This is how you should treat the patient. And not be so concerned about, well, how much money I'm going to make. No. All the business, this aspect of cost, treatment, costs and so forth should be discussed with the business administration.
So what if the patient feels that you're into his money, not into him as a person?
No, this is because the patient may feel, that's why you have to develop a rapport with your patients. You have to make them feel as though when they sit in the chair, they are a human being. And make them feel like they are a person. You have to make them feel that you care for them as a human being. You're treating them not because you want to make any money, but you're treating them because you are the one who have developed the skills to put forth the treatment that they need. So this is how you treat patients. You make them feel as though they're human. You don't make them feel as though that they are number. You don't make them feel as though that they are just a two sitting in the chair. No, this is a human being who is living, who is alive, who is breathing, who is seeing, who is hearing, who is thinking. So you treat them as humans. This is what you have to do.
Yeah. Okay. And what do you think are the most difficulties in this job? Difficulties. The obstacles.
Dentistry is a challenging profession like any other profession. So there will be days there will be challenges. Some days there will not be. There will be lesser challenges. But you have to have the patience, and you have to have the ability to have what we call tenacity. Tenacity. In other words, you have to be patient and continue with what you're doing. And also show that you have the confidence. Let the patients feel this doctor can do this treatment. I feel as though you have to bring this out of yourself so the patient can see this doctor can do this treatment. I know he can. So once you've done that, the challenges will come. This is a part of life. Challenges are in everything, But when you have this confidence in yourself and the patients feel this confidence, then the challenges sometimes are less.
Okay, doctor. What are the most important things that one could learn on his shift? Like, did you learn anything new throughout your career?
You're always learning. Dentistry is. I've been a dentist for 30 years, so your education is always evolving. I'm not practicing dentistry the same way I did 10 years ago. No, because things have changed so much in dentistry. Dentistry is a dynamic profession. So certain procedures, how you do them now, you may do them differently than they were 10 years ago. This is because the profession is engraved. You have new materials out, you have new procedures. So you have to keep update with these things, and as they say, you move with the tide. But these things are all done so that you can improve. You can improve your service. You can improve your treatment. So you have to continue with this form of education. This is all that is necessary.
So, doctor, if you haven't been a dentist, what would you have been?
Well, maybe medicine. Maybe a medical doctor.
Not engineer, nothing?
No, not an engineer. No. Maybe a medical doctor. Maybe when I was in dental school, we took courses with medical students and physiology and all other courses. I had a liking for renal medicine. Maybe I would have been a nephrologist.
A nephrologist.
Kidney doctor.
Cool. So, doctor, how do you think dentistry affected your life? Did it affect your life in a way?
Dentistry has afforded me to live a good life. I can't complain. Alhamdulillah, I've had a very good, lucrative life as a dentist. I've enjoyed many things because of the profession that I've had. So I can't complain of that. It's been very good to me.
Alhamdulillah.
Yes.
So, doctor, what's the most an advice you could give to dental students for now?
Well, make sure you know the principles of dentistry. This is very important. Always, and don't violate the principles. Once you don't violate the principles that your professors teach you, God's willing, inshallah, you will be good. Once you not only memorize them but understand them. This is important. Not just to memorize it, but to understand. Why am I doing this? How am I going to do it? Understand these principles. Once you can understand the principles that you're taught in dental school, then God's willing, and apply them. And always, like I said before, always think of patients as being humans. And once you're able to do this, God's willing, you will be successful.
But doctor, do you think a student only roles to study things, but then like you won't have an outdoor activity, or should they also have activities in college, like in student union or stuff like that?
You have to have a balanced life, even inside of dentistry. You have to have a balanced life, even as a student as well as a professional. You have to be able to do, because dentistry is a very stressful profession. So you have to have some kind of activities or hobbies that sort of can take your mind away from it. You need this. This gives balance to your life. You don't just want to do dentistry all the time. No, this is not good. You have to balance your life. So you should have other aspects of your life, deal with social matters, whatever. But you have to be able to do this. This is important.
Okay, thank you a lot, Dr. Kareem.